Pietro, okay. Say that last name.
Peter, in American. Peter Pescetelli.
Pescetelli. It's easy for him to say. And then, so he is an Italian medical doctor and is a specialist in cardiology. And he's going to present on the physical causes of Jesus' death. Thank you, Pietro. Thank you.
Thank you.
Let's give him a hand.
Ladies and gentlemen, good morning. Thank you to Dr. Rack for the kind invitation in this so important international conference on the Shroud of Turin. I beg your pardon because my English is very, very poor. But on the other hand, I know that your Italian is worse than my English. So we have no other possibility than to continue with my poor English. And you forgive, please, my terrible accent. I have my paper because my memory isn't good as a lot of time ago. The causes of the death of Jesus of Nazareth has been a source of speculation for about 140 years, namely, science publication by William Shroud appeared in the scientific literature. William Shroud was a Scottish cardiologist who first hypothesized Jesus died of myocardial infarction. The hypothesis raised a lot of debates, and in the following years, a few tens of articles were published on the topic with different hypotheses, from the death by asphyxiation to the hypovolemic and the hemorrhagic shock. Unfortunately, the few historical documents we can use are the Synoptic Gospels. Thank you. The Synoptic Gospels, which, however, take a religious perspective instead of a medical one. Nevertheless, they contain a small amount of information useful to determine the pathologic context that caused the physical death of Jesus Christ. The Turin Shroud, the most precious of the Christian relics, is a source of important and detailed information, thus making the shroud sound through forensic evidence. To analyze the traumatic signs of the body of Jesus Christ, and to inform the causes of the rapid death of Jesus on the cross. To give such inference forensic validity, two conditions are necessary. The first, the shroud must be an authentic relic, meaning that it must not be a human artifact. And the second, the body contained in the shroud must be the one of Jesus of Nazareth, lived in the first century of our times. About the authenticity of the shroud, I believe any of us has strong beliefs, and it's not within the scope of this lecture to establish the evidence in favor of the final receipt authenticity. On the contrary, more can be said about the identity of the dead person represented in it. The shroud shows signs that are compatible to the torture and the death of the Christ. This allows us to identify Jesus of the Nazareth as the person wrapped and represented in the ancient relic. In a morgue, we usually have a body whose analysis allows to establish the pathologies and the circumstances causing the death of the body itself. In this case, however, the body is missing, and we have only its image, imprinted in an ancient cloth. The faint imprint that you can see in the middle of the slide is made more available to the observer by the strong contrast of the photographic negative on the right and by the use of the cadaveric mask that you can see in the left. the cadaveric mask is a drawing reproducing the future of the dead. This represents the only object on which it's possible to make the autopsy. That's the final goal of our analysis, using the Synoptic Gospels as the only available pathologic anamnesis of the last moments of the life of Jesus. The morphological and anthropometric aspects tell us about a corpse of a male gender, around 40 years old, and of Caucasian, or more precisely, Semitic race. Such conclusion emerges from the computerized anthropometric analysis made by a team at the University of Padua, led by Professor Giulio Fanti. The team reached such conclusion from the determination of the tibio-femoral index. That's a distinct feature of the different ethnic groups. The height of the body is approximately 174 centimeters. Some thanatologic or cadaveric aspects are present on the ancient sheet, allows us to shed light around the state of the corpse here once wrapped in. The regal aspect, very relaxed, represents the signs of the loss of muscular tone that typically follows the death. The rigidity or rigor mortis, cadaveric stiffness, is a phenomenon that arises 3-4 hours from the moment of death. It generalizes to whole body in around 12 hours and usually completes it in 72. This can be read out in the hyperflexion of the head, in the asymmetry of the legs that are fixed with different angles at the level of the knees. It can also read out from the dorsal hyperflexion of the feet and in roundness of the buttocks. All these aspects are compatible with a posture blocked by rigor mortis in the upright position, consistent with the death on the cross. Another important aspect of the shroud is the lack of the signs of putrefaction. For example, the lack of the abdominal bloating or ammonia deposits near the mouth of the nose. From this evidence, we can infer that the corpse was put in the linen sheet 2-3 hours after the death, but it wasn't left there more than 36-48 hours. The principal traumatic lesions that can be identified from the visual inspection of the shroud are frontally, blood stain present on the forehead, number 1, which are compatible with the torn crown, a wide wound and the blood trickle on the right ribs, a wound and blood trickle on the left wrist, blood trickle on the forearms, and several stains on all the anterior surface of the body, compatible with the signs of the lashing. Similarly, the dorsal view allows us to identify traumatic lesions from the blood trickle on the knee, the blood belt at the level of the lower back, the wounds of the blood trickle on both feet, and finally the signs of the extensive lashing. The hemetic stains, the only ones that are visible on the exterior side of the sheet, have been identified by Professor Baima Bollone, and the blood on the sheet is an AB group. Unfortunately, the age of the relic made further genetic analysis and or characterization impossible. Nevertheless, the presence of the clot formed in vivo when the person was alive, and the partial fibrinolysis generated from the contact with the wet sheet both confirm a short stay in the death lines. The skin of the Shroud man presents signs of a brutal lashing. It's pounded with linear lesion of about 2.5 centimeters with a dumbbell-shaped mark. That's two metallic balls connected by a bridge. The height number of such lesions, 372 in total, 159 frontally and 213 dorsally, cover 70% of the whole skin surface, include bust, limbs, abdomen, and back. And you have to consider that the lateral regions of the body isn't visible. During the lashing, the victim was naked and was not a Roman citizen, as lashing was forbidden for Roman. The lashing was, however, performed in the Roman way, meaning without lash limitations, and as the Jewish model allowed 39 lashes only. The great number of lashes could hint to an entirely different punishment, which was not preparatory to the following crucifixion. A piece of data is compatible with the Pontius Pilatus change of mind that is mentioned in the Synoptic Gospels. It's so likely that the lashing was performed using two different tools, the Roman flagrant scourge, causing the widespread binate lesions, and the verga, causing the linear lesions. This is the dumbbell type injuries. And this is the evidence for different instruments used, the flagrum and the verga. There is also the overlap of the lesion. Considering that 70% of the skin were affected by the lashing, and considering that the skin presents a rich innervation and vascularization, the traumatic consequence can have determined the condition of shock for the great pain, bleeding, and the outpouring of vasoactive and inflammatory substance. The head of the hair and the face of the corpse will present the signs of bleeding caused by sharp objects that are visible in the frontal and occipital region and are compatible with the presence of the crown of or helmet of thorns. Look at the epsilon-shaped blood stain due to the overcoming of two frontal wrinkles. The face presents a bruise swelling on the right cheekbone and elongated nasal pyramid that remain off axis and interrupted by the mild lesion wound. A bruise at the top of the nasal pyramid is also visible. Under the right cheekbone, a blood trickle with divergent branches starts from the dorsal nasal wound and goes downwards. Also in this case, the uniqueness of the thorn coronation mentioned in the Gospel and not reported in any other document relative to other crucifixions, as well as the fury of the blows on the face, are compatible with a special convict rather than a common one. The traumatic lesions on the upper limbs are partially identifiable only on the frontal view, as the proximal parts of the both limbs, the deltoid region and the arms, are not visible due to the images of the chambery fire. The hands are crossed together, left hand on the right wrist on the pubic region, and the wrist we can see a round-shaped blood stain corresponding to the space between the bones. The wound is compatible with the exit hole of the crucifixion nail. The lack of thumb sense is attributed by some researchers to the lesion of the median nerve by the nail thrust in the space between the bones. Some others attribute it to the natural thumb position before and after that can be seen frontally and slightly on the side of the index finger. Blood trickles are visible also in both forearms running towards the elbows due to the angle of the nails of nailing the wrist on higher position than the shoulders. The inferior limbs shows the image of the left leg definitely shorter than the right one, given the rigidity in semi-inflection of the knee. The feet show dorsal hyperflexion by rigor mortis. The plantar view of the feet shows a clearer mark of the right foot with continuous lesion around the calcaneus. It also shows bleeding towards the toes due to the orthostatic position during the crucifixion, and towards the heel due to the likely outpouring during the lying down of the body. The left knee wound is also present, which is visible in the anterior view and can be attributed to the likely forward fall. Instead, no signs of crurifragium are to be seen. This was a method used to accelerate the death of the victims who, lacking the support of the nailed feet, rapidly died of suffocation. Here we can see the bones of a skeleton found in the ossuary of Mitvar in Jerusalem, going back to crucifixion of the 1st century. Traumatic marks can also be seen on the back. On top of the lashing marks, we can see the so-called blood belt, a blood trickle produced at the moment when the body was let down. The belt contains way hollow interspersed with red stains due to the separation of the serum from the blood cells. A rectangular area, 10 per 9 centimeters, on the left scapular and the right suprascapular regions are compatible with a trauma due to depression and rubbing against a heavy object with elongated shape, probably the patibulum or traversal axis of the cross. The subglenoid dislocation of about 3 centimeters of the right humerus with lowering of the right shoulders of about 15 degrees relatively to the left one may indicate a traumatic dislocation of the right shoulder with possible damage to the brachial plexus, nerve plexus. The consequent to fall under the weight of the cross. But this could have been also caused by composition maneuvers for the burial of the body to win the cadaveric stiffness. But the most interesting traumatic lesion for our investigation is, however, on the right part of the chest. It's a blood sign 6 centimeters wide and 15 centimeters high that outpours from a skin wound of oval shape. The wound is about 4 centimeters large and 1.5 centimeters height and is likely caused by some sharp object that hit the body around the 6th right intercostal space or 9 centimeters under the right nipple. The object penetrated at least 8 centimeters deep into the flesh, piercing the pleura, mid-lobe of the right lung, and pericardium. The height position of the victim relatively to the ground suggests that this was likely a Roman spear that was a regular item of Roman soldiers' personal equipment. The look of the blood stain suggests a sport instead of blood trickling. The stain, in fact, diverges from the wound, and the liquid doesn't appear homogeneous. Doesn't appear homogeneous. The sign, it appears instead to be formed by a large descending spots with a serum part. Such a leakage can only be due to a sudden opening of an internal closed pressured chamber, or the pleural space, or the pericardial space, where a certain amount of blood is stored. The direction of the leakage is vertical, indicating that it happened while the body was still on the cross. Furthermore, the wound shows widened and well-defined edges, a phenomenon typical of the dead bodies. That is, the spear hit the body when the victim was already dead. St. John reports in his Gospel that he was surprised when he personally saw the wound pouring blood and water after the soldier used the spear to test whether Jesus was truly dead. At this point, the marks of the crucifixion, of the extended lashing, the crown, the torn crown, the lack of crurifragium, the post-mortem wound on the rib cage, the short stay of the corpse in the linens, all these elements reported in the Synoptic Gospels allow with a high degree of confidence to identify the shroud man as Jesus of Nazareth. Relatively to the circumstances surrounding the death, all Gospels report Jesus' impressive lucidity until the moment of the pass away, moment when Jesus screamed. This is a slide of a short story of the crucifixion from first news from Herodotus, 5th century before Christ, until the last in the Muslim world for a slave crucified in Damascus in 1247. And we know that how is the death of hanging? The death of hanging is a death by asphyxiation, not of a myocardial infarction. And the time for the death by asphyxiation is a long time. Jesus died in a short time, very, very short time. In a short time and with an impressive lucidity. Such mental lucidity and the ability to scream at the moment of death are not compatible with a death by suffocation, as this should be preceded by a gradual loss of consciousness due to the respiratory failure. Indeed, suffocation rapidity leads to loss of consciousness, impossibility to execute coordinated movement or speak coherently, drink or swallow. It's thus not likely to talk or shout. Death by crucifixion was slow, of many hours, and sometimes up to 2-3 days. The two crucial points to consider to formulate the final diagnosis are the rapidity of the death and the leakage of blood and water from the post-mortem rib wound. Based on the above evidence, we think that the floor-wall rupture of the heart, a catastrophic complication of acute myocardial infarct, with subsequent hemopericardium, that's a rapid collection of blood in the pericardial space, and the sudden hemodynamic collapse, is the likely cause of death of Jesus. Indeed, the cry screamed by Jesus at the moment of death is compatible with the breaking of the myocardial tissue, followed by the outpouring of blood in the pericardial space, the hemopericardium. This was likely followed by cardiac buffering, cardiac tamponade, and immediate death. This is a case of free wall rupture of heart during an acute myocardial infarct. In this condition, if the corpse is left in the vertical position for about 2 hours, the liquid part of the blood, the serum, separates from the corpuscle, the red cells, white cells, and platelets. With the body in the vertical position, the piercing of the pericardium generates the high pressure outpouring of the corpuscles component first, the blood, seen by St. John. And the serum component second, the water, seen by St. John. The stains of blood and serum on the shroud show, in fact, the features of the blood spot followed by slower trickle. Now, the heart rupture is usually observed after extreme traumas of the rib cage, as in car accident, after compression of the heart between the sternum and the vertebral column. But in clinical practice, it represents a subacute complication of the myocardial infarct. Actually, in the Western world, myocardial infarction is usually generated from the clotted disease of the coronary arteries, sometimes complicated by thrombotic occlusion of one of these. Obesity, smoking, poor physical activity, all constitute the pathophysiological basis of the coronary acute syndrome in modern times. Jesus, however, was thin, had an ascetic life, worked a lot, and definitely did not smoke. In the last years, researchers identified an acute coronary syndrome with normal coronary arteries that can be caused by high levels of stress. A myocardiopathy due to the catecholaminic stress, also known as Takotsubo syndrome, from the name of a fishing vase used by Japanese fishermen whose shape resembled the ventriculographic shape of the heart of patients affected by such syndrome. The presence of very high stress is documented in the Gospel of Luke as hematidrosis. Remember that Luke was a doctor, was a physician. Hematidrosis is described in the Garden of Gethsemane after the Last Supper and before the betrayal of Judas and the following imprisonment. The hematidrosis phenomenon consists of a perspiration of sweat and blood and due to an intense neurovegetative stimulation of the skin vessels. It produces a vessel dilatation and increase of the vessel permeability with leakage of red cells red blood cells, from the periglandular capillaries. This phenomenon, although rare, is known and found in subjects under acute panic stress, like convicts under capital punishment before the execution, or soldiers right before a battle. An acute coronary syndrome generated by catecholaminic stress mycardiopathy is currently addressed by rest and rest-inducing drugs as beta blockers. In the case of Jesus, instead, the trial was physically and psychically wearing. The stress, lack of sleep, hunger, thirst, fear, and frustration from the shame, the translation in front of Anna, the Jewish process facing the Synedrion, the trial process, the Roman process facing Pontius Pilatus, interrupted by the exam of Rhodus Antipa, the sentence of the Roman Jews, the beating up, the lashing Roman type, the transport of the patibulum, the crucifixion, the shock. This event sequence may have given rise to an acute coronary syndrome with myocardial infarction. With normal coronaries, the following heart rupture, the hemopericardium with the cardiac buffering, and the rapid death on the cross. The timetable of the events reported in the Gospels over the course of few hours, 15, 19 hours, shows, however, also some contradictory evidence compared to such a diagnosis. Indeed, in clinical context, the syndrome happens 2-3 days after the first emergence of the acute coronary syndrome, during the first week. If we want to trust the traditional timetable of the event, as reported in the Gospel, few questions remain. Why did Jesus give orders to the disciples to prepare the Easter supper not on the Friday evening as in Jewish Easter tradition, but on the day before, without any apparent link with the holy Jewish festivity? Furthermore, why did the disciples did not object to this command, while they were usually very prone to question the master? Already in 1957, Annie Joubert suggested a revisited chronology, longer compared to the traditional one, and centered on the ancient solar Essenic calendar, where the main celebration were on Wednesday, the day when, according to the Bible, the heavens and the stars are created. The Last Supper would have those happened not on Thursday, but on Tuesday, when the day started at sunset, or more specifically, at the rise of the third star. Jesus and the apostles were known to be close to the Essenic community. They might have celebrated Easter according to the Essenic calendar. The imprisonment would have thus happened in the night between Tuesday and Wednesday. That's Easter for the Essenic community, but not for the Jewish one. Due to religious matters for Jewish people, it was in fact impossible to organize with such short notice a trial that was known to be complicated. Furthermore, the trial was supposed to end with the death of the victim by the Romans. If we trust this chronology of the events, the acute coronary syndrome determined the myocardial infarction with the complication of the heart breaking on the Golgotha would have happened on Tuesday evening. This timeline is in agreement with our clinic experience of these conditions, which, as we said, happened about 2-3 days after the acute event. The death following cardiac buffering by the hemopericardium would have happened around 3 p.m. of Friday, April 30, after 3 hours agonizing on the cross. So, our autoptic diagnosis can be acute coronary syndrome and catecholaminic myocardiopathy, stress-induced, evolving into myocardial infarct, complicated by heart rupture, hemopericardium, cardiac tamponade, and sudden hemodynamic collapse. And as cases, heavy hypopolemic traumatic shock by multiple injuries, dehydratation from sweating and polypnea, lack of liquids, bleeding by scourging, crowning of tours. I thank you for your attention.